One, two, three. You okay? Did you go to Brenda's? I was.
Hi, Barb. You're in bed? Yes, she did.
All right, good afternoon. Thank you all for your patience. We will now resume to the next item on the agenda, but before we do so, I'll turn to Parliamentarian Johnson so that we can reestablish a quorum. Parliamentarian Johnson?
Yes, thank you, Madam Chair. I'll begin to call the roll with the chair.
Present.
Vice Chair Brown,
Present.
Member Bradford,
He's here.
Member Grills. Members Jones Sawyer, Member Holder, Member Lewis, Member Tamaki, and Member Montgomery Stepp. Madam Chair, the total number of members present is 6. To establish or reestablish a quorum, we need 5 present. A quorum has been established.
Thank you. Now that a quorum has been reestablished, we'll now turn to agenda item number 6, potential action item, expert scope of work, presented by myself and Lewis. So essentially, are the experts ready to talk? This is an additional discussion around the economic consultant team, and they're going to give a high-level summary for those who weren't in attendance last time, but they're going to give a high-level summary of what we discussed at our last March meeting, and then they'll discuss a potential action item. So experts, are you available?
Yes.
You may proceed when you're.
Yeah.
Professor Campbell or Professor Kramer, if you want to lead the summary.
Well, maybe before I start or somebody else in the group starts, I would like to say that I'm concerned that people may have misunderstood the argument that California cannot afford closing the national racial wealth gap to mean that we're looking for more affordable alternative or that we're trying to be cheap. That's not what we're doing, and our goal and role is not to save the state money or to minimize expenditures, but our goal is to get the best model that will stand up to the public debate when the task force recommendations will be presented to the California legislature at large. For example, the national model would lead to the question why California is paying for slavery reparations when it was a free state. And although a reasonable argument can be made, if the model addresses California-specific atrocities, and that could be from educational discrimination to job discrimination and discrimination in sentencing, in mass incarceration, it will stand up much better to those kinds of attacks. But it's ultimately up to the task force to decide which way to go. We simply present different models and the task force can decide between them.
Thanks, Professor Kramer. I think at the high level, last meeting, this is Professor Campbell, last meeting we presented those 2 models, the national framework and then the harms or atrocities model. I think what was required for today, and I don't know if Professor Darity is able to give a high-level summary maybe of the national model, and then we could probably do the same for the state-specific harms atrocity model. As Professor Kramer said, the idea was to present both models, and the task force ultimately looking at the parameters and looking at what it is that we presented to then make a final decision on what would be operationalized.
So should I jump in?
Sure, absolutely.
So to summarize what we are calling the national model, the central premise is that racial wealth inequality in the United States best captures the cumulative intergenerational effects of white racism. And so in that sense, it captures the overall consequences of the full wave of historical atrocities that have shaped contemporary disparities in the United States. And so we argue that because that racial wealth differential is a consequence of policies that were conducted on a nationwide basis, then it would be most appropriate for the federal government to to address those disparities in the form of a reparations plan that would be conducted at the federal level. We point out the magnitude of those disparities amounts to approximately $841,000 per Black and white household, and this would constitute approximately $350,000 per Black and white individual. If we take that as the baseline for the amount of compensation that is due to Black American descendants of U.S. slavery, this would constitute a figure of approximately $14 trillion. And so that would be the minimum size of a reparations plan. The difficulties associated with replicating that objective at the state level are twofold. The first is that state and local governments do not have the capacity to meet that bill, even if they were to work individually and focus on their separate Black resident population. One of the central points that we make is that if you were to take all the state and local governments collectively, their entire budgets would amount to $3.5 trillion or less. And so it would be very, very difficult for them to meet the reparations bill. Now, one could argue that they could potentially make partial payments towards that deficit, but we would also have to then identify what the magnitude of that deficit is in each of the specific states, including California, and we would have to be able to determine the extent to which policies and practices that were conducted in an individual state, like California, produce this wealth gap. And that would be policies and practices that would be separate or distinct from the policies and practices that were engaged in at the national level. So those are two of the issues that make replication of the national model difficult at the state or local level. Certainly not impossible, but if it was to be something that was done at the state or local level, it would only be feasible to make partial payments towards the total amount that is owed, and that total amount per person, the minimum estimate we have of that total amount per person is about $350,000.
And we want to emphasize the key point here is not that the task force should not choose that because of the size, except the reality that the state unable to make the payment would then want to discount the reparations amount. And the task force would have to consider seriously whether partial payment is in fact correct and on whose behalf does one argue for partial payment. This isn't an issue of you don't ask or you don't calculate a full amount. It's an issue of, do you present yourselves in a position where you are likely to get that? It is also the case that because we're talking about differences in wealth, it is conceivable that the state could give assets, not income, to that amount, and then the task force would have to think through what does it mean if instead of giving individuals payment, the state were to transfer assets that would somehow or another be under the control of descendants of African slavery, African-American slavery in the United States. And so you would have to confront if the state decided to give assets, knowing that it cannot give income to individuals, how that would be resolved. But let's be clear that to replicate the state model is just not possible. It's the national model depends on some simplifying assumptions that hold strongly and generally. Because of anti-miscegenation laws, it is a generally true thing that if you look at the Black population in the United States as it existed in 1865, and we have reliable estimates of what the wealth gap between Blacks and whites was at that time, that going to today and looking at the wealth gap between Blacks and whites, it's a fair abstraction to ignore a very small percentage of people who would either be immigrants or late arrivals to the United States, and project that the current racial wealth gap is the result of the policies that intervene between those two time periods and the populations we observe today. If you do that at a state level, there is no such closed system. If you told us we want to compensate the descendants of people who were in California in 1865, we have no easy way to find them today. The current population of California, the Black population, clearly was, the vast majority were not the descendants of people who were in California in 1865. And so it's not possible to take the current wealth gap between Blacks and whites in California and blame that on things that happened in California between 1865 and today. Further, the Black people who are most harmed by anything that California did, the ones who are most harmed are the ones who are most likely to have left California. And so therefore, if you compare wealth gaps, you're missing the people who are the most harmed by whatever it is California did during the intervening years. That's not the case in the national model because we just did not have that huge an immigration of Black people from the United States to be worried that the people who were the most harmed left the calculation. And then you would be confronted with, if you're going to go with the national figure and you are saying that the state of California will compensate any descendant of slavery in the United States, any descendant of slavery in the United States, for everything that happened in the United States, between 1865 and today. While you have said you will give compensation to people who are California residents, you will, of course, ignite a thunderstorm of people arguing for when they were residents of California if you're going to compensate anyone for the full model of everything that happened in the United States, irrespective of California's history. And then you will have to confront on what basis is California responsible for a set of federal actions, many of which predated California's entry into the United States.
This is Ms. Mullen. Before we entertain any other questions, I wanted to ask Professor Spriggs if you would share with the task force some of the potential assets that you had in mind that might be turned over to the community of eligibility in this hypothetical that you have spoken of.
Well, I mean, it is within the power of the state faced with the debt. It could think of this as income, but it could also say, you're arguing about wealth, we will give you portions of the wealth of California. We could transfer ownership of the University of California, Berkeley to a trust fund that would be held in trust by whatever the task force, whatever the state legislature wants to say is the entity that would be the repository for the reparations. You could give the Golden Gate Bridge or any other state asset and say that we're going to transfer the ownership of that property. I mean, the state has that ability. That is a way to do it. If that's what the task force wanted, and if that's what the state legislature agreed to.
Yeah, I think most, the economist group, we all pretty much agreed that the issue of providing national reparations at the state level is really a misalignment of the harms and damages or atrocities of slavery with the wrongful acts of the state of California. And that's why we presented both models to kind of highlight that the racial wealth gap nationally cannot be partitioned or compartmentalized by California for specific actions or harms. And that kind of spilled us over into model number 2 that we also presented last time with the state-specific harms or atrocities framework.
Thank you. Thank you for that high-level summary. Professor Campbell or any others, could you just also summarize for the benefit of the public the state-specific harms model?
I'm sure I can give a high-level summary there. So from what we just said with mod number 1, the national model, as a group, we then looked specifically at developing a threshold or procedure to figure out what specific harms or atrocities the state of California should compensate for. And the idea here was to look at a way of associating or categorizing harms or atrocities that would be developed, vetted, added, changed by the expert group, and then approved by the task force. And at the last meeting, we presented, just as a starting point, 13 specific harms or categories that I'll quickly kind of reel off. We looked at unjust property taken by eminent domain, intellectual property deprivation, houselessness, unwarranted police violence, segregated education, non-representative estate commissions, housing discrimination, labor discrimination, environmental harm, mass incarceration and sentencing, health harms, transgenerational effects, and we also had a category for other potential harms. I will also add that the task force presented 4 more categories beyond this that I'll also mention here. This was from the discussions where other harms that should be considered was segregated education, and there was a specific note that there's a focus on tertiary education, the war on drugs, the crack cocaine epidemic, family and child welfare, especially in foster care, and gang prevention was also presented as other categories that the task force wanted us to kind of look at when we talk about the state-specific or atrocities model.
Thank you. Thank you so much. I have a clarifying question. I wrote it down. So this is a question about the national model, and this is again just a clarifying question because I know that the task force, voted to endorse the state-specific model. But I guess I can point this question to Dr. Darity or any of the economists who would like to answer. What about revisiting the national model feasibility if a scaled-back version is something that we could consider from a calculation perspective? So, for instance, Dr. Darity said, in order to close the racial wealth gap, the state would have to, give out $350,000 to each, Black American who's part of the community of eligibility, and how the state just does not have that capacity. But again, what about, revisiting it so that maybe it's 1/8 or 1/10 of that 350 number? And I think you already answered that in your remarks, but I'm curious to if you have any additional thoughts on that. Darity or Spriggs?
You certainly, as a task force, you can recommend whatever you prefer. If you wanted to advise the General Assembly to adopt a plan where there was some form of a partial payment, 1/10 of the gap or 1/8 of the gap, that's certainly your prerogative. The question that I personally would raise is, what is the rationale for that proportion?
Yes, I would add that you would be negotiating on behalf of the descendants. It would be like a class action suit. And so it would be, how did you consult with your clients that they agreed to a partial payment? Normally, when we think about recovering harms, we don't think about the partial payment in that way. So you'd have to give us the justification. We could make a calculation for you based on what you thought that was. It's not 1/50th, if that's what people had in mind. And the idea that California is agreeing to 1/50 because it's one of 50 states. And so by conceding that the harm has now been resolved, that we've now created restorative justice, that's the dilemma. That's the question you would have to answer. And so that would be the challenge, as I see it.
Thank you for, go ahead.
And again, in addition, you were saying that the state, which was not part of the United States for a large portion of the history that you're seeking redress for, how are you arguing that the state is responsible for things that were federal, not state, and things that preceded the state being part of the United States? It seems inconsistent with arguing that this is an issue of lineage, because you're complicating your own assumptions when you argue that this is all about lineage.
Okay, so I had a follow-up question. In terms of the rationale or justification, something that I'm thinking about or just that I came up with, part of the statute, AB 3121, it mandates that any of our recommendations comports with international human rights law standards. So as we know, under international law, there's 5 forms of reparations, and compensation is one of those forms. So again, this is a clarifying question because to my understanding, and I think this is what Dr. Darity has said in the past, under the state endorsed model where we're listing these harms, there could be a potential where a person could be a part of the community of eligibility, but if they're not able to articulate a particular harm necessarily, then they would not be eligible for compensation. But as you know, the reason why we define the community of eligibility is because these people are descendants of chattel slaves and they have faced generational harms, and that has shown up in the racial wealth gap, which we are addressing in some ways or another. And so I know you all are economists, but I'm just curious to know if to you all, if that's compelling, the justification or the rationale is that our recommendations must comport with human rights law or international law standards, and under maybe a scaled back version of the national program, everyone that's a part of the community of eligibility would be eligible for compensation.
Chair Moore, just a point of clarification on our end. Our understanding is that the community of eligibility is not limited to individuals whose ancestors were enslaved in the United States. We were under the impression that also included are individuals who were free, are descendants of persons who were free blacks prior to 1900, who would also be included. And so I think that may affect the interpretation of the applicability of different dimensions of international law in this context.
And Chair, you're saying international law, but again, the question is the state of California did not exist for much of the atrocities you are seeking, we are calculating reparations for in the national model. So this would be akin to saying that any country is liable because there are people fleeing Uzbekistan right now for what Russia is doing in Uzbekistan, because some people from Uzbekistan are fleeing and coming. This is the question. Why would a state that's not a party to what we're saying is harm, why is that state obligated?
Okay, is there any other questions, comments? Member Gross, you're recognized.
No, I'm just testing my mic.
So I have to say I was having difficulty with all of this as an oral presentation with nothing in front of me to kind of look at. Okay, is this better? No. Is this better? Okay, thank you. I've been having difficulty trying to track all of what has just been shared because it's an oral presentation with a lot of moving variables and it's complicated. And I found myself trying to understand, so what are they arguing here, or what are they saying is not workable? Can we get something that's in writing that we can review in advance so that we come with informed questions about what they're saying, and so that I can, me personally, I can better understand what they're saying. I heard things in there that I'm not sure I know what I heard. And I tried to take notes, but I found I had more question marks in my notes than details on what was said.
All right. Hello? Okay, here we go. Can you maybe just, restate why you asked for the clarification? So, because I also had a hard time following, and I think what we want to know is basically asked the economic experts to restate the two options. Can you tell us why you asked for them to restate the two options? Because I think what might have gotten lost is that there was a point of clarification. It felt like that's how the testimony from the experts began, and then it felt like it slipped into some kind of argumentation. And so for me, it was difficult to track what exactly the intention of their communication was just now.
So I asked them to summarize what we discussed last meeting. So essentially, their summary was essentially what was discussed in the last meeting. They had a presentation as well. I thought that they would use the same presentation to guide the discussion as they did in the last meeting, but there's no presentation. They just wanted to give a high-level summary without using the same aids that last meeting. So again, what they just stated is literally what they stated at the last meeting, which was introducing these two models, a national model for compensation for the community of eligibility and a state-specific harms model for compensation. And essentially what they just did was give a high-level summary of the national model and its implication, and then the state-specific harms model and its implication.
I have the PowerPoint from the last meeting open in front of me, and I still couldn't track it. So, because it sounded like at one point they were arguing, almost, why is California even doing this?
Yeah, yeah, I heard that.
And
too.
then the next thing I thought I was hearing was, it's not possible to calculate if we're using lineage-based. So then I'm scratching my head. So then I thought I was hearing something else. Again, if I appreciate, and I think it is important for us to get their thinking post the last meeting, but just that oral presentation isn't allowing it to be absorbed in a way that we really know what we're hearing.
Okay, so there isn't any other action item for this agenda other than them giving a summary of what they presented at the last meeting, and then also having a potential conversation about whether we want to prioritize the harms for the state-specific model. So I'm not sure if just to be solution-oriented, would you like the presentation that they presented last month to be on the screen for folks?
No, because I don't think that's going to clarify. I think that they added more thinking to what we heard last month, and I couldn't quite track what that latest thinking was saying. And it sounds like it's very, very important. So I just want to make sure that we are able to receive the information in a way that make sure we're understanding what they're saying. So to put the original framework, I said I had this up in front of me,
Right.
and that wasn't helping me to track. What are we at the bottom line? If we had to, your elevator version, what's the bottom line about the use of lineage-based? What's the bottom line about California not being a state at the start of the national harm? What is the bottom line point about the ability to do a state reparations process when the monetary implications exceed what would be a state budget? So I think there are several things that they were saying. It's not about going back to the old PowerPoint. It's about understanding what's the bottom line on all the things that they were saying today.
Well, I will say, thank you so much, Member Girls. Thank you for that. When prepping for the meeting, I had a conversation with Professor Campbell and Professor Kramer, and it was just give a high-level summary of what we discussed, and then if there's any questions. But then we heard from Dr. Darity and Dr. Spriggs. I think they're the ones who introduced that new information about lineage and all the other stuff. I didn't have a conversation with these two people, Spriggs or Darity. So they're introducing new information. And so I don't know where to go from here, to be quite honest. I could, you can have a conversation and ask some clarifying questions for Darity and Spriggs. If that's helpful, or we can table the conversation until.
I would suggest that we ask them to provide. I'm sorry.
Yes.
May we be allowed to add?
Is this Professor Mullen?
I think what I would suggest is that.
Yes, one moment. Just let Member Grills speak, and then I'll go to you.
Is that given what we shared in the last meeting, and their ability to have had time to deliberate amongst themselves and think about it, that they provide us something in writing that lays out what their best thinking is about the harms-based model, the national model, the harm model, the implications of all of the directives that we gave, not just lineage-based, but also the 13 harms. A number of the things that they said today, but just lay it out so that we can really digest it and then have a conversation, because it sounds like then we need to come to some kind of conclusion or consensus as a task force about the implications of some of the things that they shared today. But I don't think enough of us fully understand it to have an intelligent conversation.
Mullen? Professor Mullen?
So, Brittany, I mean, one of the considerations is that, you know, wait, I'm sorry, we've got two different sets of volumes going. You have, in your recommendation, or your definition of the community of eligibility, you speak of African American. And so therefore you are, on the one hand, talking about race, but then you also are talking about lineage. It's not, you know, what you all have laid out so far is not one or the other, but both. That's part of the complication.
Yeah, well, and then the further complication is associated with the idea that making a decision about eligibility necessarily makes a decision about what type of compensation should be forthcoming. Those are not necessarily issues that are resolved at the same time. And so we've been trying to say, given the community of eligibility that you've identified, here are two major strategies for trying to provide compensation. And one of those strategies, which we're calling the national model, is not something that can be implemented effectively at the state level, particularly if one is trying to accomplish the objective of doing the whole thing. If you make a decision that you only would like to do a partial active redress with respect to the differential in wealth, then, you know, certainly that's an option. But it would be helpful to us to know exactly what that percentage is and what is the motivation for selecting that particular percentage. Our feeling thus far is that type of an approach, assigning a monetary value that is linked in some way to the wealth gap, is something that is not really the best way to do it. And so that's why we have argued instead that there should be a focus on trying to do this from the standpoint of identifying a set of atrocities. If there is a concern that there are individuals who've been subjected to these atrocities who would have difficulty establishing that they have experienced such a harm, I think that would provide a basis for the task force, including a provision for a state-based agency to provide people with support in establishing their claim at no expense to them. So that potentially is another component of the project.
I think, again, to Member Gross's point, at the planning meeting, it was just me, Professor Campbell, and Professor Kramer. And so these new ideas or suggestions or added implications from Darity and Mullen and, you know, to some extent Spriggs, I was not aware that, you know, this was going to be in the scope of the presentation today. So I agree with Member Gross in that we don't have enough in writing on paper to have an intelligible conversation about how to best proceed with these, the implications that you're raising. Senator Bradford, go ahead. One moment.
No, go.
Oh, sorry, go ahead. Professor Spriggs, you're recognized.
Oh, yes, thank you. I thought at the conclusion of the last meeting, we listened to you pass a motion in which you concurred that using the state-based approach was correct. We thought that this was a conversation where you were, having passed that motion, were simply asking us for greater detail because, as we understood it, a lot of people had concerns that the motivations for that motion weren't what they would agree to. So I thought, were responding because since you passed a motion that we would do the model that was state-based, that you just needed us to answer some questions for you.
Yeah, my question is the 350,000 per person or 14 trillion based on the wealth disparity, or is that how you come to that number? And based on wealth disparity, and what's the population? What's the total number who would receive that? That how you come to that number? And based on wealth disparity, and what's the population? What's the total number who would receive that?
Yes, that's correct.
And I guess it was stated that the state couldn't afford that, and I would argue that they can. And
Wait, hold on, Senator Brett, Dr. Darity?
Black Americans would be eligible to receive reparations by meeting the standards that they are Black people who are descendants of persons enslaved in the United States. That 40 million times approximately $350,000 is what gives us the $14 trillion figure.
Okay, Senator Bradford has a follow-up question.
well, yeah, a statement of how we afford it. The state could easily set up, or through this task force, recommend that the state set up an annuity or a trust fund where we set aside, say, a 0.5 percentage point of our annual budget. And as revenues go up, the deposits go up. As revenues go down, the deposits go down, but do a 0.5%. That would be budget dust, a 0.5 percentage point. The state would not miss that. And you do that over a period of years where you really impact folks' lives, because even at $350,000, that comes out to $1,000 a year for over 400 years of bondage in this country. So I still say that's a pittance when you think about the overall harm. So if we figure this out right, the state can't afford it over a long-term period. If you're talking about just a one-time payment today, no, they couldn't do it. But if we create an annuity or a long-time trust fund based on the percentage of revenues coming into the state, we can fund this for decades.
Well, the issue is, and this is entirely your decision as the task force, but the issue is how long would you like to spread out the period of compensation? How long would you want to be providing people with compensation in relatively small amounts that probably would not have a significant impact on the quality of their lives? It's an issue for you all to resolve. And Kirsten Mullen in our work have suggested that any payment system that attempts to meet the goal of reaching $350,000 per person should not extend beyond a decade. And I think that kind of time limit would be very, very difficult for the state of California to meet in terms of trying to reach the $350,000 goal. Of course, if you want to stretch this out across 50 years, that you can, in drips and drabs, provide people with these funds and meet the constraints that the state budget has. But that's your judgment.
No, we're not talking about 50 years to pay someone.
What would stop legislators from deciding that they're no longer going to make these payments? So you get 3 years or 6 years down the road, and then that gets reversed.
As the only legislator here today, you can set up a variety of, is Ms. Jones still your honor? Okay. You can set up a variety of ways to compensate folks. I mean, it could be zero home loans for folks who have never had home ownership in California. We could provide that. You can, again, free college tuition at our UCs and CSUs. You can have that for folks who have never attended college. There's ways to continue to compensate folks who have been harmed. And it's folks who've lived in this state for generations who have never owned a home, and we can help them become homeowners. So it's a variety of ways, in addition to a cash payment, that we can continue to make people whole. So we shouldn't just look at a cash payment as the only way for compensation. It can be a combination of things.
Can I briefly ask a question?
Yes, go ahead, Professor Kramer.
Thank you. Yeah, but I'm a little confused because I was also under the impression that the state-specific model had been voted on, but at the same time, I think now I'm getting the impression that there is a debate about which the national or the state-specific model should be pursued. And I think, if I'm not wrong, I assumed that we as the expert group would present both in our report, the national model and the state-specific model, so that that decision which one to follow would not necessarily have to be taken today. Am I wrong in this, or?
No, you're exactly right. At the last meeting, the task force did approve going forward with the state-specific model. And so this particular part of this conversation for this meeting was supposed to be a high-level summary of both models, explaining how we got to this decision to endorse the state-specific model. But then in questions and comments from the task force, I'm also hearing the same, I don't know, hesitancy maybe, where there might be, you know, a feeling from the task force that we might need to revisit both models and just have more time and more information, and something in writing from the economists about the implications of this more. That I guess is more than the PowerPoint that we were provided. But I'm happy to hear my other colleagues and see what they're thinking.
Can I say something?
One moment. I want to hear from member Jovan Scott Lewis.
So I think what has happened is that in the request for a high-level summary, right, there's a lot of confusion that has been introduced, where the summary was taken as some kind of recommendation or some kind of reintroduction of the possibility of these two models. Am I coming through clearly on this? It keeps coming in and out. Is everybody hearing me? Okay, maybe this is this. Okay. We did vote on what I think Dr. Campbell was calling the harm-based model. We came up with 13 areas. My understanding is that today we were going to be asked for further clarification about those 13 areas. I recall the term prioritization being used in some of the explanation. We decided on the community of eligibility. What we are now being asked to do and what we're asking the experts to do is to go away and figure out, right, how to calculate the harms across these 13 areas in the state of California. That's what I understand that we're here to do. I don't think there's any concern or need to return to a question of the national framework. It was just something that experts were asked to reintroduce. I'm not sure why exactly they were asked to give a summary, but we did decide last meeting, and we voted that we would go with, I think, what's being called the state model, but what was called in the last meeting, specifically by Dr. Campbell, the kind of harms-based model, where we came up with about a dozen areas, and then there was one kind of broader category as number 13. So I think the experts are just looking for further clarification and guidance and direction about how to identify what those harm areas are. And so if I'm hearing Dr. Spriggs correctly, what he wants to know is how are we meant to trace some of those issues? So throughout the process, Dr. Spriggs has been very curious. For example, if some of the harms that we are identifying has caused Californians, right, who are a part of this eligible community to leave the state? How are we going to account for individuals who had to flee the state as a result of any one of the 13 harms? And so I think what they're looking for is a further clarification from us. I don't think we're trying to relitigate or reconsider either of these models. We've decided the community of eligibility, done. We've decided on the state-based, or what's also called the harm-based model of these 12 to 13 areas, done. So then what we now need to do is just the process of refinement. And I think that's where we should be really thinking about what is being asked by Drs. Darity.
May I interject that Ms. Mullen in a moment will describe the procedure that we've already begun to try to examine those 13 areas of atrocity. But I would like to say before that the proposed compensation schemes that Senator Bradford is talking about are hugely appropriate and actually are quite consistent with the harms-based approach. I do want to say as a proviso, though, that those kinds of strategies will not individually nor collectively close the racial wealth gap. But there is no essential reason why state-level compensation schemes must necessarily be designed to close the racial wealth gap.
So the five of us have set out a division of labor, looking at those 13 plus harms. And the idea was that we would take a deep dive and look at how you would go about measuring and, importantly, coming up with recommendations for compensation for those specific harms. But we've had 9 days since the last task force meeting, and we've not had 9 days since the expert group got together. So we've only begun that work, and it's really extensive. I mean, for example, just looking at the property taking for eminent domain, there are a lot of questions to consider. Do you look first at cities that have the largest absolute numbers of Black residents? Do you look at cities that have the largest percentage of Black residents? Do you look at the cities that have seen the largest exodus of absolute numbers of Black people? You might be looking at, for example, cities that have airports, stadiums, convention centers, dams and waterways, reservoirs, college and university systems, these major infrastructure projects that quite likely displace many, many people, and potentially, particularly for the projects that are located near the downtown of these major cities, those are the neighborhoods often where Black people were forced to live. So it's not a trivial exercise to begin to unpack some of this. But we started that work, but we are really literally at the beginning stages of trying to map out the different ways that you might consider when you're trying to figure out who was harmed and how much.
One thing that we also wanted that we thought would come out of this meeting was for the task force to even help us prioritize. We have 13, plus we opened it up with the other potential harms. So if there was a sense of prioritizing, which one should we start with first? Maybe the task force has some ideas about particular areas that we could actually prioritize, or we start digging into this. As Kirsten has kind of pointed out, we have started the work of looking at the different atrocities. And one thing we wanted to know was whether or not the task force had a sense of prioritizing this list as a beginning for some of our analysis.
Okay, thank you for that transition.
Madam Chair,
Yes, you're right.
I would like to lay on the table we need to consider being very specific about reparations, including restoration of these historical landmarks in major cities, California. I'm thinking of the Fillmore in San Francisco, the iconic institutions, South Central Los Angeles, and definitely Allen's Worth. These places were destroyed by public policy. All of them. The evidence is there. So, I hope that we will highlight that, lift that up.
So this is Javan again. So my view is that the economics group is, further to what Dr. Brown just said, is charged with coming up with a number for the injuries. They are not responsible for coming up with the forms of compensation for those injuries. That's the job of the task force. I mean, of course, we have several people as a part of the economics team who have come up with, I think, really robust and innovative, reparatory frameworks, and we may want to consult them at that point. But at this conjuncture, the objective of the economics team is to go away with our guidance with these 13 areas in mind and come up with a way to account for the cost of the injuries in these areas. Then we at a later stage, and we'll talk about this, during this meeting when we think about our schedule for the remainder of the life of the task force, how we will come up with a compensatory model. So right now, I think it's good for the task force and for the economics team just to prioritize the job, which is to look at the 13 areas if that's what we're deciding on. And to come up with a figure for what the cost of these various acts of dispossession, violence, harm, discrimination, etc., have cost. And I'll remind everybody that it's not just the cost of the disadvantage to the eligible community, but it's also the cost of the benefits to those who perpetrated these harms and injuries. And so I think we have to look at both sides of the equation for when we're thinking about how to identify the figure, and that we would then later on determine appropriate forms of compensation for.
I'm sorry, what was that?
Can you talk a bit about the prioritization piece so we can move forward?
Sure. So we last meeting, we just had the 13 categories with some additional. I mean, it's on the presentation that we gave last time. I think within our group, we wanted to know if the task force wanted us to prioritize these 13. So we just had them listed 1 to 13. But is there a sense of, from the task force, whether we look specifically, because as Professor Mullen just kind of highlighted, each of these categories is expansive and huge, but maybe the task force wants us to start with, labor discrimination or environmental harm. I'm just throwing things out. We wanted to get a sense of if there was anything that we should start with from the task force for these 13 atrocities or harms that were identified.
So I think member Lewis, you essentially stated that we don't necessarily need to prioritize out of the 13, or we just move it.
I mean, when we talked about it, right. So my comment was that these are all, each is a very legitimate area, and so the notion of prioritization is a bit curious to me. I mean, I'm happy for us to discuss how to, further clarify, even operationalize what something like environmental harms means. If we're thinking about toxicity level in a neighborhood, or if we're thinking right? About its relationship to the industrialization. We can do that. But the areas that we identified last meeting, I think, are all necessary areas. So, I mean, that was my point, Chairman.
Yeah, maybe I'm using the term prioritization incorrectly. I don't mean in terms of one having precedence over the other in terms of its magnitude of harm. I think it's just for us to parse out what we start with as the economist group. So I'm sorry if I wasn't communicating that properly. It's just, if it is the case, just a matter of, do you want us to start somewhere first? If not, it's just the 13, and it's the idea of use the literature and use your experience to guide you and start with whatever first. And I think that would be perfectly fine.
Does any other task force members have any thoughts on that? Are there particular harms in the 13 that they should prioritize, or should allow them to use their discretion to prioritize the harms within internally?
Thank you to the experts for providing the input. So as I understand it, this is Donald Tamaki. As I understand it, Professor Campbell, you are referring to more or less sequencing and not prioritizing in the sense of one subject area being more important than the other. So just thinking out loud with you, in the area of sequencing, housing discrimination is at the root of any of the issues, not only those things that Pastor Brown talked about, urban renewal, destruction of communities, but also environmental, certainly, education, segregation, policing. Much of that, I don't say begins and ends with housing discrimination, but housing seems to be at the root of that. And in connection with California's complicity with the Jim Crow aspects of housing discrimination and where people live, that also dictated where they could work, what their opportunities were, what health resources are going to be available, what kind of environmental exposures people are subject to. So maybe that, if I'm reading you right, Dr. Campbell, maybe as a matter of sequencing and taking into account California's culpability in that, maybe that may be one place to begin the analysis. So please provide us with your feedback on that.
Yes, thank you. Yes, sequencing is a better word rather than prioritizing, because I don't want to give the impression that the group thinks one particular harm has a greater magnitude or effect. So sequencing is more appropriate. And I agree with your analysis about housing discrimination in terms of a starting point.
So following, and I'm really happy to hear the idea of sequencing rather than prioritization. And following Member Tamaki's line of thinking, I would suggest that mass incarceration and sentencing would be another important next step in the sequence. That represents a massive drain on the capital, the social capital of our communities. It devastates our families. It is it pretty much determines the rest of quality of life. It impacts children in very significant ways in the Black community. So I would suggest that mass incarceration and sentencing would be an important next area. Any other comments? Well, I did have one other question. I did hear earlier in the discussion some mention about the assumptions that are inherent in the models. And at some point, it would be helpful to see what some of those assumptions are. which takes me back to, it would be helpful to get some kind of written summary from the economics panel. You know, what you have to share is so important. And what comes natural to you will take the rest of us a few moments to really digest. And so having that kind of laid out in front of us would be helpful, but also, you know, the assumptions inherent in the model would be good to know as well.
Can I add that it would be great to do that, because while Camila and I are the advisory committee for this, we are working on behalf of the task force. And so we want to be able to be, you know, capable of conveying what the task force really does want to accomplish to the economists when we meet with them.
Are there any other, so it seems as if we are endorsing the idea of sequencing. And so there are people who named housing discrimination and mass incarceration. We probably will have to put this into a motion so that we can give the economic consultant team formal guidance.
And it seems to me that if we do this sequencing approach, that it might be helpful to cluster certain areas. So for example, if we look at the housing might be coupled with houselessness and eminent domain, because those are all kind of interconnected. The
Sorry,
environment.
Member Chris. Can the DOJ put on the screen the list of harms? Thank you so much. Go ahead.
Yeah, so the health harms could be coupled with or done in sequence with the environmental harm and the adverse emotional and physical health consequences. I mean, so anyway, I'm not going to try to do all of them, but I'm thinking that it might be good to cluster.
So again, do the members of the task force, do you think that we need to entertain a motion around this at this time? Also being aware of time. We're over time for this portion of the agenda.
It seems like we're in consensus about sequencing. Our parliamentarian perhaps could guide us. Do we need to make a motion related to that?
I'm sorry, would you repeat?
Yeah, so we seem to be in consensus about sequencing the harms. And so do we need to do a motion or?
Are you trying to ask the task force to take a particular action?
We're trying to give guidance.
Guidance to the economic.
For next steps. So-
Right. You can formulate a motion asking them specifically if you want the task force to ask them, the committee, to do something specifically, ask that in the form of a motion. Move to do what it is that you are seeking to do. I cannot hear you very clearly. Okay, so.
She's just saying, is it necessary to do that if we are in consensus based on the discussion?
No, it's not. No, it's not. If you want them to just take that under consideration as they move forward, then you can just state that. You don't have a motion to make.
Okay, so then, okay.
So that when they report back, then they will come back with that information.
Okay, great. So we're under the consensus that we'll go with the sequencing option, but then we'll also have to have a brief discussion about how to pair the harms that are listed. So I know Member Grills began to do that already when she said that housing discrimination and homelessness should be, and eminent domain should be paired. We might have to do that as well, for instance, for mass incarceration and unwarranted police violence and sentencing. Health harms will probably have to be paired with transgenerational effects. Does anyone have any other suggestions?
Chair Moore, Chair Moore,
Yes, you're right.
this is Ms. Mullen. I just wanted to thank you. I just wanted to add that we need to be really clear that in order for the, for the expert measurement group to make any progress, we're going to need a tremendous amount of support in the way of data collection from the Department of Justice. I mean, we are currently, going through archival materials that we can access, but a lot of these records will be information that we cannot access without, without their authority.
Yes, and the Department of Justice presumably has the data that we'll need on mass incarceration.
So in terms of consensus, so we can just move the agenda forward. In terms of sequencing, I believe we stated that the economic consultant team could begin in terms of sequencing, starting with the areas of harms related to houselessness, eminent domain, housing discrimination. And then the second tier would be mass incarceration and sentencing, unwarranted police violence. And then maybe a third one would be transgenerational effects and health harm. Is there any feedback on that?
I'll make a motion that we sequence the above you mentioned.
Thank you.
I thought we said we didn't have to do a motion.
We
don't have to
do a motion. We don't have to do a motion. Okay, so we don't have to do a motion, but there is consensus in terms of the economic consultants. So in terms of sequencing, first address houselessness, eminent domain, and housing discrimination, and then mass incarceration and sentencing and unwarranted police violence, and then transgenerational effects and health harm. Is there any questions from the economic consultant team?
Madam Chair, could you please speak into the mic?
Oh, sorry. Yes, so in terms of sequencing, we came to a consensus that we would start in terms of the economic consultant team, start with houselessness, housing discrimination, and unjust property takings by eminent domain, and then mass incarceration and sentencing and unwarranted police violence, and then transgenerational effects paired with health harms.
Madam Chair, before you can declare there's a consensus, did you ask if anyone objected to that?
Does anyone object to that? No, hearing no objection. So is there any last clarifying questions or comments from the economic consultant team?
Oh, that was very helpful.
Great. Okay, anything else? All right, thank you so much for your time, and we'll be in touch. So.
Thank you. Thank you for some clarity.
Thank you. Thank you very much.
Thank you.
Bye-bye.
Thank you so much. Okay, so the next item on our, thank you. So we'll now move on to the next item on the agenda, which is item number 7. Witness panel 2, college to professional education institutions. So our first witness is Dr. Joyce King. Dr. Joyce King is recognized for her work on issues around racial equity and justice in American education, specifically their impact on teacher training and Black education, a professor of educational policy studies at Georgia State University since 2004. She is the provost emerita of Spelman College and has served as president of the American Educational Research Association, the nation's leading organization focused on the use of research to improve education. We'll also hear from Sylvia Drew Ivy. Sylvia Drew Ivy is a special assistant to the president of Charles Drew University of Medicine and Research. She serves as an advisor on community relations and affairs. In her role, she works with health centers, community-based organizations, and community coalitions to develop and implement programs that promote the university and its strategic plan. In addition, she assists with establishing and promoting positive external relationships with various groups. The last person we'll hear from is Simone Anderson. Simone Anderson is a native from Richmond, California. She is a fourth year at University of California, Los Angeles. She is graduating this spring with a Bachelor of Arts in African American Studies. Currently, she serves as the chairperson for the African Student Union at UCLA. Formerly the project director of the African Education Project at UCLA, she is now the co-founder and lead organizer for Richmond Revolution in Richmond, California. Anderson has a strong commitment to justice, service, and grassroots organizing. I believe the first person we'll hear from is Dr. Joyce King, and she is on the phone, so I will put the microphone next to the phone. Thank you so much, Dr. Joyce King, for being present remotely, and you may begin your expert testimony when you are ready. Hello? Hello? Hello?
Yes, I'm here. I'd just like to know if you can confirm the amount of time that you're giving for me.
10 minutes.
Okay. Well, Chairman Moore, Vice Chairman Brown, and members of the task force, thank you for your invitation to here. 20 minutes, so to cut it short, whoever's met the best we can. I need to say that I am presenting to you as a citizen scholar, not in my capacity as a professor of Georgia State University, given legislative developments that are happening in the state. I grew up in Stockton. I'm the first person in my family to go to college, and I was a student at Stanford participating in the Black student movement. My first professional appointment was as director of ethnic studies at Mills College, and then I went on to Santa Clara, where I was director of teacher education for 12 years. I served on the curriculum commission for the state of California at a time when there were many clashes over textbooks and the curriculum framework. I'm going to talk to you today, which I've written in a statement, about why we need Black studies theory, curriculum, and pedagogy in teacher preparation, the evidence from K-12 to college to professional institutions. And if we can move ahead, it's already mentioned that I served on the American Educational Research Association as president. I'm also going to talk to you briefly about the recommendations that came from the AERA Commission on Research in Black Education, which I chaired. This commission established a group of scholars to educate major issues that hinder the education of Black people and to move these issues to the forefront of the association's agenda. The recommendations in a book, Black Education, under the heading Transformative Research and Action Agenda for Human Freedom, remain relevant and represent the best thinking of Black scholars and practitioners who were engaged in a serious and sustained examination of the education that we need. And I present these recommendations just briefly as a vision of the scope of the needed repair that the task force can consider. The late Dr. Asa Hilliard served on the commission's Elders Council. So just a couple of the recommendations that are in the written testimony that I presented include identify teachers whose culturally nurturing instruction improves student performance and support ways this group of teachers can pass on their knowledge to other teachers, identify new models of service, development that can change teachers' habits of mind and classroom practices. Identify methods of visionary parent education that address the problem of student alienation and achievement. There are 10 recommendations in my written testimony that I offer to support this position that I'm talking with you about. I'm also sharing findings from the Black Leadership Kitchen Cabinets Assessment and Research Project, which I conducted in Santa Clara County with Dr. Linda Tillman in 2018. We were asked to investigate 4 areas of inquiry: the community's definition of quality education and students' access to quality education, barriers in the education system and policies that are hindering students' access, and impacts of discrimination and racism, as well as best practices. We found that some members of the committee hold assimilationist views. Others value cultural affirmation. These are responses to the cultural dislocation of miseducation and white supremacy racism. While Santa Clara and Silicon Valley is important and world renowned, the reality is that the grade point average for most African American ancestry students was 2.0 when we did this study. There are more mixed race students in this community than students who identify with their African heritage, and the former are less likely to want to attend culturally nurturing Saturday school, after school, or an African-centered school program. Some participants, including educators, feared being perceived as racist or self-segregating. Activist educators nevertheless describe how they create culturally affirming academic programs that function as safe havens to provide quality education for African and African ancestry students. This is the term they used in this study. Participants also mentioned the importance of teaching students about their heritage, and parents described how they have resorted to providing homeschooling with a focus on academics to ensure that their children achieve higher scores, passed required exit exams, and went on to college. Regarding barriers in the education system, participants identified issues related to curriculum, instructional materials, and policy deficiencies, as well as problems with classroom interactions with teachers and administrators that may contribute to harsh disciplinary action, and the problem of the absence of Black teachers in that community. Both overt and subtle forms of racism and discrimination were identified, including educators' low expectations, curriculum issues, and the fact that students experience the absence of protection from racism and discrimination by school personnel, even at the level of preschool. In her recent testimony before the U.S. House Appropriations Subcommittee on Labor, Health, and Human Services, Dr. Linda Darling-Hammond described a framework for whole child development approaches in K-12 education that includes, quote, a foundation which teachers can learn how to implement that begins with developing positive developmental relationships and environments filled with safety and belonging that promote strong attachments and relational trust. Unfortunately, for Black students, such a foundation for safety and belonging is mostly absent. In 2014, Dr. Ella Hollins, Dr. Geneva Gay, and I wrote a response to proposed regulations for teacher preparation in the Federal Register. Our response addressed the benefits of culturally inclusive curriculum connected to students' cultural heritage. This response is included in my written testimony. One of the most traumatic legacies is the way slavery is taught. And I have included with my testimony a spreadsheet that shows 73 reported examples of misguided teaching in the nation from 2000 to 2020, not only in social studies. One example, and I'm on slide 5 now, if they're moving. A Georgia 3rd grade teacher assigned math homework that used slave beatings and
One moment. Can we
So these are just several examples of this misguided teaching. And one example actually came from a California school in Cerritos, where students were reportedly forced to role play as slaves while teachers pretended to be ship captains and had the kids listening to a clip from Roots. The next slide, slide 6, 10-year-old Lily, the only Black child in her class in Texas, spoke up when the lesson appeared to erase slavery. Students share their pain and anguish with their families, and outreach parents bring these incidents to the attention of school administrators and the media. Parents also engage in what researchers describe as racial socialization, teaching their children from home. And I mentioned the need for visionary parent education. While the number of ethnic studies courses that can provide a supportive and engaging learning for Black students and others is growing, there's also a fierce, radically conservative, anti-democratic political backlash taking place that includes removing school board members and school administrators, banning books, and banning teaching about race and white supremacy racism. This is reminiscent of the McCarthy era and is already having a chilling, silencing, self-censoring effect on educators at every level, including the professional educators in teacher education. I'm on slide 7. I'm going to skip over what I intended to say about ethnic studies. There is growing research that shows the benefits of ethnic studies for students. What's missing, however, is research that shows how ethnic studies and Black studies benefit teachers. And the problem is that these kinds of questions are not as well funded. Researchers are examining ways to improve pre-service education and pre-service teachers' knowledge of Black history and their consciousness. This research is being undertaken 2 decades after I introduced the concept of disconscious racism into the literature based upon my study of my students at Santa Clara University who believed that racial inequity was caused by slavery, not systemic racism. This uncritical habit of mind is not unconscious or implicit bias. It is the result of miseducation that leaves no room for moral engagement on the part of educators. So I think I probably have maybe 5 minutes left.
Yes.
Several researchers that I mentioned in the testimony are actually studying how knowledge of Black history can improve teaching. And this is an important development that needs support. And I'm going to skip over now whoever's handling the slide 9 and then 10. And the example that I'm going to really lift up here is the policy that the school board in San Francisco passed in 2020 to call for a Black Studies curriculum. So if you go to slide 9, this policy was passed in October 2020 in support of creating K-12 Black Studies curriculum that honors Black lives. And the policy is very well elaborated, taking the position that the Eurocentric focus of American education and other American institutions has framed the history of Black people as either enslaved, discriminated against, or suffering under those social ills. And there's a harmful myth and misconception that elevating individual achievements of African Americans alone can translate into broader inspiration and motivation to achieve. So move to slide 13 quickly. Therefore, be it resolved that the San Francisco Board of Education approved and supports the development of a K-12 Black Studies framework and curriculum. And I'm suggesting that this is something that deserves support. The district proposed how much it would cost. I encourage the task force to look closely at that resolution. And I'm going to conclude with the statement, why do we need Black Studies theory and practice in college and professional education? In a 2015 article titled Back to the Woodshop, Black Education, Imperial Pedagogy, and Post-Racial Mythology under the reign of Obama, Professor Curry stated, education of Black people, specifically Black youth, must be deliberately geared not only to the preservation of Black history, but also to the recognition of the inability of American white European political categories to actively express the degree of political freedom necessary to deliver Black liberation. Mimicry of our oppressors instead of innovation and popular ideals will Black people. 2003, Dr. Gloria Ladson Billings, past president of AERA and past president of the National Academy of Education, concluded that the typical K-12 social studies curriculum has changed very little in the past 30 years. And I quote, while the social studies can serve as a curricular home for unlearning the racism that has confounded us as a nation, she noted, yet we still find teachers continuing to tell us lies. And that is why we need Black studies, theory, pedagogy, and practice in the preparation of teachers and school leaders. Thank you very much.
Thank you, Dr. Joyce King. And the next person will have to speak is Sylvia Drew Ivy. And Dr. King, you can stay on the line for questions and comments at the end. Dr. Sylvia Drew Ivy, you may begin.
Can you hear me now? Yeah, thank you. Thank you so much for having me here today to discuss the issues that you are addressing from a health perspective. Your mission and the mission of the commission targets the issue of racial bias in all the domains that have been discussed this morning. And certainly when you think of South Los Angeles, you begin to think immediately about race and ethnicity as the reason for the problems that we've suffered over the generations. Professor Paul Ong from USC suggests that the stigma of inequality in South LA is space related as well as race and ethnicity. And that has impact in housing and employment and in transportation and of course in healthcare in that domain. So I want to suggest to you today that you think not just in terms of the categories, 13 categories or the combined categories that you've been discussing, but that you think about place in terms of a nexus for the suffering that, that we have experienced in the state among the Black population and the brown population as well. If you go back over the history of South LA, you see that it initially started out as a white community. And beginning in the 1900s, Blacks came from the South for jobs, for low-cost real estate, and for less racism than they had experienced in the South. But right from the start, the racial covenants kept the Blacks who arrived here in segregation. We had a famous Proposition 14 that tried to validate the legality of racial covenants in deeds. Then World War II came along, and there was a tremendous need for workers in aerospace. And so again, Blacks rose to the opportunity and came in large numbers. They had very few places that they were allowed to live because of the covenants. That problem of not being able to find places to live was exacerbated tremendously by the appointment of Chief William Parker as chief of the police, and he served in that role from 1950 to 1966 and was a major cause of the Watts Revolt in 1965. Chief Parker was a race baiter. He shattered nightclubs. He blockaded stores that were frequented by multiple races. And the commission following the Watts Revolt found that the police behaviors were a major reason for the Watts Revolt at that time. The Watts Revolt left 34 people dead, most of them Black, 1,032 people wounded, 3,952 arrested, 600 buildings were damaged and destroyed. So this is the place. This is South LA. They renamed it South LA to try to get rid of the South Central bias. But we have a geographic area in Southern California that has suffered more than most any other geographic area, I would say, in the state. The Watts Revolt galvanized the emerging civil rights movement, and then there was an economic downturn and more suffering. Fewer people with jobs, fewer people with cars to get to jobs, still segregation in housing. So the area and the people trying to get out of the area didn't have to be told, oh, we don't hire Blacks. They just had to say, we live in Watts. And that reason was enough to block their progress in securing stability in their families. South LA has been branded and the people have suffered. And in the health arena, this is also a very, very serious history. Sweet Alice Harris, who's a beloved leader in the South LA area, talks about having to have a child with asthma being $10 sick. If the child wasn't $10 sick, you couldn't get them to a place where they could get care because they didn't have cars, and it cost $10 to use a taxi. So the question was, when the baby was coughing, is the baby $10 sick? Which is a terrible calculus to have to make when trying to care for your family. South LA didn't have a hospital, they didn't have jobs, they didn't have cars to get to health care. This is where Charles R. Drew University comes into the picture. We had a few dedicated Black doctors in the Charles R. Drew Medical Society who were incensed that their patients had to go so far for care. We also had activists in the community like Sweet Alice, like Lillian Mobley, like, sorry, blanking on the name at the moment, but those 5 women who were instrumental in demanding that health care be provided to South LA um, worked with Supervisor Kenny Hahn to get a university that focused on healthcare. And it was only because of their advocacy that Charles Drew University came into being in 1966. CDU is the only HBCU west of Texas, and it works with a myriad of community partners. The most recent one of which is a very large group of partners who've come together to talk about prevention in healthcare. And that has been an innovation to use the lens of prevention in all manner of community activities. We work, of course, with the MLK Hospital and the Watts Health Foundation. We work with the Community Black Caucus. And as you're thinking about how to use the funding in issue here, I hope you will consider thinking about the institutions that connect with the community actors who have endured the problems that you're talking about, and using that as a fulcrum for redress in place in stigmatized localities like South LA, so that we can be empowered together, not just as individuals to receive compensation, but to work together as community, as we so effectively have worked together in the past to solve our problems. Use us to empower community leaders to work together to solve these issues. Thank you very much.
So the next person we'll hear from is Simone Anderson. Simone Anderson said she's having she's struggling with the dial-in. So I'm going to try to tell her to call again now. If not, I'll just use my cell phone. Hey, Simone. Yes, I just need to say yes. Okay, thank you, Simone. You may begin your expert testimony when you're ready.
All right. Hello, everybody. Dr. Miller already introduced me, talked me up a little bit, but I am currently the chairperson of the African Student Union at UCLA. We've had a lot of protests this year just in terms of student activism, particularly around what's been affecting Black students on this campus, what's been marginalizing Black students for about 15 years now, just in terms of receiving equitable access and retention resources for Black students on this campus, as well as some controversy around the Blackburn Resource Center, which is the name of our Black Resource Center campus. For 16 days, students held a sit-in in Murphy Hall, the longest sit-in in UCLA history, as we protested for a number of things, or at least for ASU's end. It was behind the BVRC and really fighting for shared governance and, students' ability to decide for resources for our community, what resources our community needed. It was a lot of meetings. It was very long, but in the end, we did make some progress. Our Blackburn Resource Center now will be the first Black resource center in the country that will have a governing model of any kind, and it will be student dominated. At UCLA, we have this thing called student-initiated, student-run, things that students create for us, by us, where students make decisions ultimately and govern our communities. So that was very big, obviously, for Black students to be able to have a stake in our own resource center and be able to make decisions that were appropriate for us. The importance of access and retention of resources, some people might be wondering, I mean, obviously after Proposition 209, we saw a severe decrease in admission and enrollment for Black students, all students of color, but severely for Black students. In 2006, the infamous class of 96, as we refer to it, 8 years post Prop 209, only 96 Black students were admitted and enrolled into UCLA. That was pretty devastating, right? Not even a full 100 students, but that ultimately prompted things like the holistic admissions campaign in the UC system and some other things. Since then, ASU has created its own access project that does a lot of work specifically with students in LAUSD, Pasadena Unified, and works in conjunction with the admissions office to touch, Black kids in other regions beyond Los Angeles. Our project is responsible, honestly, for the admittance of a lot of Black students in higher education. But again, that's a service that students provide that we had to create and do ourselves. We have a retention project. The importance of retention is obviously making sure that we are retained, that we stay here once we get into the university as Black students. There's not a lot of institutional support here for Black students. As you see, students have to go out of their way, provide counseling resources, academic resources, course planning, degree planning, you name it. Students do all of that, including getting dismissed Black students readmitted into the university, as well as, contesting admissions appeals and several other things to make sure we have access to these opportunities and that we're retained once we get here and we graduate, in a feasible time, a 4 to 5 year plan. I say this to say that although I'm very proud of the work that our union has done in 56 years, I am very proud of the work we were able to accomplish this year, but it is still the work of students. And it really begs the question, what does reparations look like? We had this discussion with the chancellor actually during the protest at one of these meetings. Chancellor Block admitted that the university has failed to adequately support Black students, especially looking at the result of what's occurred in the community programs office with Black women specifically for the last 15 years. So there's a lot of reparations clearly that Black people are owed, nationally, but specifically, definitely in a college context. To me, reparations and support looks like the university helping these student programs, the university, and not just funding, but obviously providing institutional support to support Black students to make us feel welcome here. It shouldn't all be on students because unfortunately Black students come here and they only see ASU. And these are the only spaces where they feel like they can be themselves, unapologetically Black, where the only Black students care about other Black students. And that shouldn't be the case. Black students, even people, I would extend this to Black staff and faculty as well, they should be able to exist in other spaces beyond ASU, beyond the AFAM department. It's only so big. And I think the university, and they know that they need to do a better job just about expanding to be more inclusive and to providing long-term support for Black students. I mean, a lot of our Black student population here, they're foster youth, they're first generation, and some other things, they're low income. We have a lot of student populations here that are vulnerable. We have a large Black immigrant population here. Our African diaspora encompasses multiple identities, more than 20 different identities throughout the African diaspora. We truly need this to be an inclusive space for everybody. I said this in a meeting and it was affirmed by the Vice Chancellor of Student Affairs that UCLA prides itself on being number one in a lot of categories, but UCLA is not number one in equity. And I think that's very important in terms of where we need to go and what we need to be focusing on moving forward. That's just something we've observed, or I've observed at least in my time here, being on ASU staff for 4 years, as well as now serving in the highest role possible as a chairperson. And that's what I really hope. And hopefully, the Black Girl Research Center will be a start. But again, it shouldn't be all on students. UCLA should be doing a collective push as a whole to make sure that Black people are supported. Just like other people, send their kids here, their second, third generation Bruins. The Black community, Black people, Black Los Angeles, Black people, period, Black students, period, deserve that same support, commitment, and long-term investment from the institution. So that's just my take on things. But I appreciate everybody for having me. But that's honestly what I hope we're able to accomplish one day, and hopefully one day soon at UCLA, when you guys are thinking about that, thinking about resources like Black students, don't have access to a lot of scholarships. There's just a lot of different things that could be done to make things more equitable for Black students to have these opportunities in higher education. Thank you, guys.
Thank you. Thank you so much, Simone. Thank you again, Dr. King, Sylvia Drew Ivy, and Simone Anderson for your incredible testimony. I'll now turn to my colleagues for any questions or comments. Great. Hearing no. Oh, go ahead. Member Grills, go ahead. You're recognized.
Of course, I have something to
Takes a minute.
So this is actually a question to any of the panelists. As I listened across the testimonies, I started seeing a kind of a formula for success for Black students, whether you're talking at the preschool, elementary, high school, or higher education level. And those elements include kind of like establishing relational ties with the people in the institution and creating a sense of belonging, which also then leads to a sense of ownership of the school. Second, couple that with a Black studies curriculum so that you see yourself in the studies and the material becomes more relevant. Plus the third element, using a cultural and contextual grounding and understanding, as well as a place-based understanding of what's happening with education. So if we look at those three elements, are there any examples out there in the world? I'm not even going to limit it to the United States, but out there in the world that has demonstrated the effectiveness of these elements in combination? And if so, where are they? Because that becomes a potential roadmap for some recommendations for education success for our children. And that's for anyone on the...
Immodest, but I think Charles Drew University is a model of making that happen. We take 4-year-old children and teach them anatomy, and we have graduate students in nursing and in medicine and in public health. We have students who are behind educationally because they've been in schools that didn't prepare them, and we work with them to bring them up to level so that they can participate at the appropriate level in our health-centered activities and education. We connect and are guided by community members. We have community faculty who teach our medical students. The curriculum is vetted by the whole faculty every year so that we ensure that it is sensitive to the issues that were responsible for the birth of the university. Excellence in education, which is not connected to the anguish of the people that we're trying to provide opportunities for, doesn't work in our experience. It has to have both. They have to be 2 tracks at all times. So it's not perfect. We're still small. We're proud of ourselves that we've gotten to be a medium-sized university after being small for many, many years. But there's obviously so much more to be done, and there are so few examples of the kind of partnership that CDU has tried to develop with community because of the oppression that I've described earlier.
Have there been any evaluation studies?
I can't
Have there
hear-
been any studies to evaluate the effectiveness of what you have been able
Yes,
to?
yes, there have been.
Have
Yes,
there?
there have been.
And would it help to have more resources to further demonstrate the effectiveness and to kind of develop dissemination models?
Well, I think yes, I think the studies do document the validity of the approach that we're using. Our students really go quite far, and most of them started in deficit. Most of the students started in deficit.
Okay, Dr. King, did you want to answer that question for Member Grills? Dr. King? Dr. King? We were just corresponding, and she said she wanted to answer the message. Okay. Simone? Are there any other questions? Hello, Dr. King?
Hello?
Yeah, we can hear you now.
Okay, thank you very much. If I understood the question correctly, it was about a community example of programs that work effectively. Is that what I heard?
Yeah, are there any, yes, I couldn't quite hear what you're saying, but I was asking whether or not there are any examples of the combination of the relational ties that are necessary along with sense of belonging, plus a Black Studies curriculum, plus grounding everything in a cultural and contextual reality.
Okay, thank you. Oh, okay. First of all, I would refer the members of the task force to the written statement that I submitted. There is a bibliography as well as examples of the research that exists. I did say that more research is needed and funding to support that kind of research would be helpful. There are, of course, studies that show the effectiveness of African-centered education. With respect to the question of belonging, what I would say is belonging is not what I've been advocating in my testimony. What I've been advocating is a sense of self-determination that allows students and teachers to appreciate their own identity. I just refer you to James Baldwin's statement, who wants to belong to a burning house? So we're not, from my perspective, the goal is not to assimilate students into something that is already anti-human, but to give students of all backgrounds and their teachers the critical capacity to create educational spaces that are humanizing. So belonging would be lower on my list of priorities, but there is definitely a body of research that shows effective educational practice along the lines of Member Grill's question. And some of that research is cited in my.
Again, I think Simone wanted to answer the question as well. So Simone, you're on speakerphone.
Yes, I think representation and belonging in conjunction with obviously university curriculum, specifically Black curriculum, is important for students to feel like they belong. Another initiative that ASU has taken, our first access project / community service project, is the African Education Project, which is 41 years old. We've been serving South Central, Compton, and other Black communities in Los Angeles for 41 years. And we go into high schools as well as elementary schools. Now we also focus heavily on elementary schools because we have another project that kind of does more direct high school work, which is state. But these two projects specifically work through educating Black students, Black youth through a Black lens, teaching them about their culture, their history, even, political science, other things through a Black lens. We've done, urban planning workshops and just other things to kind of give them this wide variety of these different things that are at the university level. This is what you can get a degree in. This is what, if you want to own a business, if you want to help your family, if you want to come back and, build your community up, maybe this is a pathway you're interested in following, at the university level. But sometimes, until you put it in that Black lens, until you get it from that perspective, until you're able to honestly relate and make a personal connection, to that as a Black person, that all plays into students' decisions in pursuing higher education. And I often believe that because of the lack of representation in academia of Black people, that plays into it becoming extremely overwhelming and difficult for Black students to exist there, for them to get there, and for them to finish there once they do get there. So I definitely think having this representation is key. Being able to have this perspective also plays into Black students obviously coming and being retained. And I think that also looks like reparations, like hiring Black faculty, putting Black staff and faculty, in higher positions, not to be performative after Black Lives Matter and do something reactionary, like giving people one person a promotion or hiring an advisor for Black Life, which is what the university did. No, it means respecting, the Black people that are here. It means wanting to invest and grow the AFAM department. It means investing and expanding Black faculty and staff at this university. I think representation is a good thing that is offered at the level. So thank you guys.
Thank you. Any other questions or comments? Hearing no other questions or comments, I want to thank the panelists. Thank you so much, Dr. Joyce King, Sylvie Drew Ivy, and Simone Anderson for your incredible testimony. So we'll move on to the next item on the agenda, which is the break period. We'll break for 10 minutes and we'll reconvene approximately 3:30, it's fine, at 3:30, and then we'll go to our last panel of the day on the school to prison pipeline.